Dear all, Namaste. In this video, I am going to discuss about different indications and contraindications of tonsillectomy procedure. As you know, tonsillectomy is one of the most commonly performed surgery in ENT and head and neck surgery. There are certain indications of doing tonsillectomy. They are local indications, systemic indications, and as an approach to other surgery. Out of them, local indications are the commonest indications for tonsillectomy, and commonest amongst these is recurrent tonsillitis. Recurrent tonsillitis means when tonsil infection is repeated again and again. It is not Paradise criteria. Many of our students get confused with Paradise criteria and recurrent tonsillitis. Recurrence means when it recurs time by time, but that tonsillitis which meets Paradise criteria is indication for tonsillectomy. Please don't be confused. The Paradise criteria states that when the patient is having more than 7 episodes in 1 year, or 5 episodes per year for 2 years, or 3 episodes per year for 3 years, then patient has to undergo tonsillectomy. This is basically due to office loss in developed countries, and sometimes when there is recurrent infection that may affect different organs, including the heart, leading to subacute bacterial endocarditis, kidneys, glomerulonephritis, or the joints, rheumatic arthritis. Therefore, it is better to undergo tonsillectomy when the patient is having recurrent tonsillitis. The next is after a second attack of quinsy in adults and a single episode of quinsy in children. In adults, peritonsillar abscess may recur in around 20% of individuals, but in 80% people it does not recur. Therefore, if it recurs for the second time, then it is an indication for tonsillectomy. Next indication being malignant or benign tumor or unilateral tonsil enlargement of suspicious cause, may be cancer. So for biopsy purpose, we need to remove the tonsil. This is one of the common indication. Intertonsillar abscess, if we cannot remove the abscess, if we cannot drain the abscess, then patient has to undergo tonsillectomy. In children, when the tonsils are enlarged, leading to obstructive sleep apnea syndrome or repeated mouth breathing are indications for tonsillectomy. Tonsillolith or tonsillar cyst with halitosis may be an indication for tonsillectomy. When there is impacted foreign body in the tonsil and that cannot be removed, we can do tonsillectomy for that purpose also. Systemic indications are rheumatic fever with arthritis, subacute bacterial endocarditis, glomerulonephritis, and diphtheria carriers. Next indication is as an approach to other surgeries like excision of steroid process. Elongated steroid process is called as Eagle's syndrome. When the steroid processes are more than 3 cm in size, they may press upon the tonsils, leading to glossopharyngeal neuralgia. Tonsillectomy can be performed as an approach to other surgeries like glossopharyngeal neurectomy and branchial fistula excision, which are in the deeper aspect of the tonsils. This is also performed as a part of uvulopalatal where tonsils are also removed along with the soft palate and the part of the lateral pharyngeal wall. What are the contraindications for tonsillectomy? The single absolute contraindication for tonsillectomy may be aneurysm of internal carotid or tonsillar artery, in which condition there may be increased bleeding. Other contraindications being age less than 3 years. The reasons are the mouth opening is limited, the child's immunity may decrease because till the age of 5 years the tonsils are supposed to increase the immunity. There may be more blood loss which is not tolerated by the children, and after surgery lingual tonsils may hypertrophy that may lead to foreign body sensation in throat. In acute infection there may be more bleeding, so this is contraindication for surgery, but we don't perform surgery routinely during acute infection. We do interval tonsillectomy. Bleeding disorders like hemophilia, cleft palate which leads to rhinolalia aperta, cervical spondylosis which affects surgical position because the neck has to be extended. Other conditions like diabetes mellitus, hypertension, tuberculosis may be the relative contraindications for surgery, but we perform surgery in controlled conditions. Occasionally, in females during menstruation, tonsillectomy may be contraindicated because there may be vicarious bleeding. When the patient is having infection or granulopharyngitis, the infection may flare up after tonsillectomy, so we delay the procedure for some time. And hemoglobin less than 10 gram per deciliter may be one of the relative contraindications for surgery. Although nowadays the tonsillectomy surgery is performed without more bleeding. In the exam, please don't tell local focal like that. just local indications, which are the commonest ones, as an approach to different surgeries, and systemic indications. Please subscribe my channel, Dr. Krishna Koirala, for more videos like this, which are important from theory as well as practical point of view in your final MBBS examination in ENT. Thank you very much.